Hi everyone, I'm Ratanin. I'm a PhD candidate from Faculty of Tropical Medicine, Mahidol University. My advisor is Professor Dariswaran Tratit. Today is my pleasure to give you a talk about my research project. The project is about the phenotypic and genetic alterations of Burgerius stomati in patients to relapse and persistent infections. Let me start by talking a little bit about melioidosis. Melioidosis is a fatal infectious disease that caused by gram-negative bacilli bacteria called Burgerius stomati. The disease emerged in tropical and subtropical regions, including Northeast Thailand. The mortality is quite high. It is about 40%. This bacteria is an intracellular pathogen that can form a shelter's white wall nick to protect themselves from immune response and antibiotic treatment. So the disease is quite difficult to treat, resulted in severe disease, relapse, and persistent infections. If melioidosis patients survive from the infection, they have three different outcomes. So the first outcome is good one. So they get respond to the antibiotic treatment, so they better after discharging from hospital, and they also get better after receiving complete dose of oral antibiotic treatment at their home. And the second group is relapse and reinfection patients. So the patient respond to antibiotic treatment, but after completing the dose, um, they get they get ill again, and they have to come back to admit into hospital again. The last group is persistent infection. This group patient never respond to antibiotic treatment. In our study, we perform a cohort in Northeast Thailand to collect bacteria from relapse or reinfection patient and also from persistent patients. We collect bacteria at the first admission and also bacteria from second admission. After collecting bacteria, we perform multiple experimental laboratory and also analysis to see the difference between the bacteria collected at the first time and the bacteria collected at second time. So we're going to see what happened to this bacteria during surviving within the house for some period of times. Our cohort enrolled about 1,300 melioidosis patients in Northeast Thailand. And from our study, we see that the prevalence of relapse infection and persistent infection is quite low compared to previous study. So previously we see that the prevalence of relapse is quite high. It is 9.7%, but now in our study we see only 1.2% of relapse and a very low persistent infection is 0.7. So this indicates the improvement of treatment for this disease in Northeast Thailand. We then infected the first and second isolated human lung cell to see the chance of the ability to spread from one cell to another cell. So the infection showed that the second isolate from patient number 17 have the higher ability to spread from one cell to another cell than the first isolate. So this is the chance of the bacteria themselves to have a higher virulence to cause disease. Apart from the comparison to see the difference in infection ability, we also compare the genome of the first to the second isolate of persistent and relapsed patients. The comparison show that the mutation happened in 6 of 20 patients, and most of the mutation were the non-syndromal SNP. So non-syndromal SNP changes the amino acid sequence of the gene and may change the function of the gene. The comparative genomic analysis also show the deletion in second isolate compared to the first isolate of patient number 12. So this deletion happened in TET-R family recollector genes, and this deletion has been tested to involve with meropenem resistant. For patient number 17, the second isolate has 5 SNPs different from the first isolate, and the most interesting one is a SNP happened in Ty6 secretion resistant protein gene. So this SNP is postulated to evolve with the chance of the ability to spread from one cell to another cell, like I show in the last slide. In conclusion, Our study found that the prevalence of relapse infection was low, indicated improvement of treatment, and during surviving in host, bacterial stimuli can mutate themselves to increase the virulence and antibiotic resistant ability. Thank you very much for having me today.